Do you have pain on the outside of your elbow and forearm that prevents you from doing gripping movements? If you do, you might have figured out that you have lateral epicondylitis or tennis elbow. In this video, I'm going to show you the most recommended exercises from the top 8 physical therapists and physiotherapists on YouTube. I have analyzed and categorized all the exercises that the 8 different physical therapists and physiotherapists have recommended across their 8 YouTube channels, and I have the list here. There are 4 categories of exercises that have been recommended for tennis elbow: massage, flexibility exercises for the wrist and forearm, strengthening exercises for the wrist and forearm, and strengthening exercises for the shoulder. Category 1, massage. 2 of the 8 channels recommended cross-friction massage of the forearm and the level of the lateral epicondyle. Bob and Brad recommended 30 seconds to 15 minutes of massage daily, or 3 times a day for 5 minutes. Bob and Brad also recommended functional mobilization with wrist extension, active range of motion as an alternative. Category 2, flexibility exercises for the wrist and forearm. 4 of the 8 channels recommended some type of flexibility exercises for the wrist and forearm. There's wrist extension, active range of motion, wrist flexion, active range of motion, wrist pronation and supination, active range of motion, wrist radial and ulnar deviation, active range of motion, forearm pronation stretch, forearm supination stretch, wrist extension stretch, wrist flexion stretch. Category 3, strengthening exercises for the wrist and forearm. Resisted wrist extension, as resisted wrist flexion, as resisted pronation and supination, resisted radial deviation. There's eccentric strengthening of the wrist extensors, eccentric strengthening of wrist extensor using resistance bar, eccentric strengthening of supinators, wrist extension isometric, Category 4, shoulder strengthening. 4 of the 8 channels recommended some type of shoulder strengthening. There's shoulder W in standing, shoulder W in prone, the prone T exercise, kettlebell swing exercise, shoulder external rotation exercise with a weight. For managing the inflammation of the tennis elbow, Bob and Brad recommend the use of ice massage. Tone and Tighten recommended use of ice pack. Bob and Brad and AskDoctorJo also recommended managing the pain with electric stimulation. When I teach my patients what to do for their home exercises, I usually like to pick about 3 to 4 exercises for them to do at home. If I had to pick 3 to 4 exercises from everything that we talked about, I would pick 1 massage, 1 stretching exercise, and 1 strengthening exercise. I use 1 massage to release the tension manually, also to warm up the muscles and relax the muscles. I use 1 stretch. Usually I give the wrist flexion stretch to release the tension, or if they have the flexibility, I give them the composite wrist flexion stretch. For wrist strengthening exercise, my favorite exercise tool is the resistance bar. That should be plenty for the person to do, and also not too much to remember.